Does your care recipient wear compression socks or stockings for their health? Today, we're going to go over why someone might wear them, techniques to help your care recipient put them on and take them off, and making sure they fit right. Listen carefully, as they can be tricky since they're tighter than regular socks. Let's start with what they're used for. Compression socks can help improve circulation in the legs, reduce pain, swelling, and the risk of blood clots. Have you ever seen someone on an airplane wearing them? That's because when you're sitting for an extended period of time, blood can pool in the bottom of your legs and cause problems like varicose veins and inflammation. Compression socks squeeze the lower legs and stop the fluid from building up. It's important to note that not all compression socks are the same. They come in different types, sizes, and pressures for different purposes. Some will even have features like open toe areas, Velcro fasteners, or zippers. For the sake of this video, we're going to divide them into medical grade and non-medical grade compression socks. Medical grade compression socks treat conditions like vein damage, circulatory problems, or if you've had recent surgery. They must be prescribed and supervised by a doctor. They come in pressures of 20 to 30 and 30 to 40 mmHg, which means millimeters of mercury. It's how we measure the blood pressure. They're best obtained through your care recipient's doctor. Now, non-medical grade compression socks are used for general comfort, and although they don't need to be prescribed by a doctor, it's always a good idea to consult with your doctor before wearing them or stopping them. These come in pressures of 8 to 15 and 15 to 20. You can find them at medical supply stores, online, and at most pharmacies. Some shoe stores even carry them. Let's move on to discuss how to actually help someone with compression socks. You might be helping a lot or a little, depending on the person's condition or their symptoms, and if they have any movement restrictions. The first step in choosing the right size. You don't want the socks to be too tight, too loose, or not high enough on the leg. To find the right size, you'll need to measure both of their legs, as they may not be exactly the same as one another. The best time to do this is in the morning, before any swelling happens, and while they're seated in a chair with their knees bent 90 degrees. Here, watch Monique demonstrate with this tape measure. She's going to measure the ankle. She's going to write that down, and then she's going to measure the widest part of the calf. And remember, do this in the morning. Perfect. All right, lastly, you have to measure the distance from the heel to the top of the calf. You do this on both legs. All right, perfect. Once you have the measurements, check the sizing guide on the packaging or the product website to get the right size. Be sure to measure the legs regularly and document it so that you can recognize if the size changes. All right, fast forward. You've bought the perfect size compression socks for your care recipient. Now what? We're gonna prepare to put them on. Are you ready?
I'm ready.
Okay. We're gonna start with having the care recipient sit in a chair or lie on a bed. Today, we're gonna be sitting in a chair. Then you're gonna make sure all the lower limbs are clean and dry. So I'm gonna place my foot up on your lap so it's easier for you to get to my leg. So you're gonna make sure that the bottom of the leg and the foot are clean and dry. You're gonna inspect the skin before you put it on. We're looking for wounds, signs of infection, pressure sores, anything on the foot that needs to be reported to your doctor before we put the sock on. Note the temperature and the color of the toes before putting on the socks so that you can compare if there's any changes after you take them off. So now you're gonna smooth out the wrinkles and unfold the fabric of the sock, especially around the toes. We don't wanna have any wrinkles at that bottom part where the toes go. We're gonna make sure the pressure is evenly distributed and reduce the risk of skin breakdown. Are you ready?
Yes.
Okay. We're gonna go step by step. We're gonna turn the sock inside out, bunching it up to the heel. This just makes it easier to get onto the foot. We're gonna line the sock hole up to the toes and start to cover them. So go ahead. Roll the sock up the rest of the limb. For thigh-high socks, make sure the person can still freely bend their knee. These are just gonna go to the top of the calf. When you're working your way up, make sure that your fingernails or any rings that you have on aren't scraping the skin and making any tears. All right, now you're gonna adjust the top band so that it's even and flat. It's very important that the sock is lying flat. Watch for any bunching or rolling down of the sock. This can create a tourniquet effect and restrict the blood flow. Does it look good?
Looks good.
All right, if you're having trouble, you can try using rubber gloves to get a better grip on the sock, or consider buying a device called a sock aid that can help with dressing. You can also use roll-on adhesive or powder to keep the sock in place all day, but make sure you talk to your doctor before you start that. All right, the socks are on, and it's time to assess the fit. You want to do a visual inspection from the toe to the knee. We're going to feel for bumps. We're going to make sure that they can move their leg, especially at the knee and at the ankle. All right, make sure you ask your care recipient how it feels. Make any adjustments that are needed. If it's not put on correctly or uncomfortable, fully remove the sock and reapply. Once the socks are on, make sure they wear them for the recommended amount of time. If they take them off too early or leave them on too long, you won't get the right benefits. So refer to their instructions or consult your care team if you're not sure about the wearing schedule. Okay, now we're gonna remove the socks. So we're just gonna reverse those same steps. Careful not to scratch or dig at their skin. So we're gonna watch Monique. It's important to take care of the socks when you're not wearing them. So once you roll the sock down, over the heel, and pull it right off the foot, this sock needs to be laundered. You're not gonna put this sock back on until after you've washed it with mild soap and then laid it flat to air dry. If possible, try to have multiple pairs so you can always have some ready while the others are drying. You need to replace the used socks every 3 to 6 months to maintain their quality and support, and always store them in a safe, dry location. Let's review what we've covered. Compression socks apply extra pressure to help people with swelling in the legs or who have impaired circulation. Unlike regular socks, they must be cared for and worn a certain way to work properly. They can be challenging to manage, but there are many techniques to make it easier on both you and your care recipient. Remember, no one will be perfect the first time. Practice and experience with compression socks will make managing them easier. Use a team approach to ensure they feel comfortable every time. It's okay to make adjustments if needed. Make sure to plan extra time during the dressing routine in case you face some challenges. Go ahead and try some of these techniques on your own, and thanks for watching.